talk about your health is Dr. Jeremy Pollock, a cardiologist at the University of Maryland St. Joseph Medical Center. Doctor, welcome back to MPT.
Jeff, thanks for having me on again. Always love coming out here.
It's good to have you. We're here to talk about blood pressure this time. For the first time in like 8 years, we have new recommendations. What's changed?
You know, we always love when new guidelines come out because we can reassess them, see what's different, what's the same, start to talk to our patients again. So new guidelines now, there was a lot of emphasis on things that were old from the old ones and a couple new ones. The big thing that I loved about these new guidelines is the emphasis on prevention and a very holistic approach to your health. And that's not much different than 8 years ago.
I noticed the numbers didn't change. They didn't give everybody 10 bonus points or anything.
Yeah, I wish. Numbers are about the same. So we look at numbers, we think of what is good blood pressure, what's normal blood pressure. On average, less than 120, that's the top number. Over 80, that's the bottom number we consider normal. Pre-hypertension, meaning before you're hypertensive, is somewhere under 130, so between the 120 and 130 range. When we get above 130, we're starting to talk about stage 1. That's between 130 and 140. And then anything above 140 we consider to be stage 2. That's the same as it was 8 years ago, so no different this time.
And then at the top of that chart that most people have seen, there's the hypertensive crisis, correct, which we should talk about because, you know, it's an emergency.
Yeah, hypertensive crisis we consider usually above 180, the top number, and it's with symptoms. So symptoms of high blood pressure where you have vision changes, headaches, confusion, shortness of breath, or chest pain. These are things where you're picking up the phone and calling 911 and going to your local ER.
The thing about blood pressure is most people have no idea because you don't feel it. I mean, you could be at 100 over 70 or 150 over 90 and not feel any difference, right? That's
right. So we consider hypertension, high blood pressure, similar to coronary disease, to be the silent killer because you don't feel hypertension. If you're starting to feel it, it's way too late. Same as coronary disease, you can't feel plaque in your arteries. So for hypertension, it's about identification early, knowing that you're at risk for it, and putting a foundation and structure in place to try to prevent it from progressing.
What is it doing to our bodies while we don't know it's doing it?
So keep it simple, right? It's a plumbing system, right? So if your pressure on your organs is higher, so your kidneys, your eyes, your heart, your lungs, your brain are seeing a higher pressure over time, years, decades, that can cause damage. So if we can identify that higher pressure that those organs are seeing earlier in that process, we can change the trajectory of that disease so it doesn't affect all your organs.
Two numbers, because the heart beats, and that's the top number,
yep,
right?
I like to keep it simple. So we can get into the weeds and talk about the top number, systolic, that's the beating, or the bottom number, the diastolic, that's the relaxation. What I like to coach patients on is I really want you to just focus on that top number because that's the pressure those organs are seeing, right? And we want that top number on average to be less than 130.
Okay. Remind our viewers, if you have a question about blood pressure medications, you can send us an email, livequestions@mpt.org. What's the relationship, you mentioned some of the organs that are affected, the relationship to heart disease?
Yeah, so hypertension we consider one of the 8 risk factors for heart disease, right? So if you have high blood pressure, that increases inflammation and increases pressure that the heart's seeing over time, and that can cause accelerated development of crud or plaque in your arteries. So keeping your blood pressure under control is part of the 8 things that I'm recommending all my patients do to try to prevent heart disease long term.
Raises the question, what are the others?
It's a softball, right? So again, the treatment for hypertension, the treatment for high blood pressure is very similar to the treatment for heart disease. And I cut it down into 2 groups. Group 1 is what we all care about. Those are the holistic interventions. People typically don't like taking medicines. People love to hear about what can I do without medicines to improve my health, right? So number 1, the key to longevity, it's not a magic pill, it's not a magic clinic, it's exercise. Daily exercise. And we can all exercise, right, Jeff? Nobody has an impediment to it. Exercise can be as simple as walking. If we can do 30 minutes 5 days a week, you're doing better. And if you can do 30 minutes 5 days a week of some sort of exercise, you can lower your blood pressure. Number 2 to that is weight, right? We all want to be at a healthy weight. And I think many of us wish that exercise could lower our weight. Once you're over 25, 30 years old, it's really hard. So weight loss is caloric intake. It's nutrition, right? It's what we're eating and how we're eating it. Number 3 is the nutrition, right? What we're eating, low salt diet. When we're talking about hypertension, high salt, average American's taking in about 5 grams of salt. If you can bring it down to 2 grams a day, which is very hard, it's not just pouring salt on food, it's the salt content in our food. You can lower your blood pressure. So it's those 3 big things: weight management, nutrition, and weight management, exercise, and nutrition can really be a holistic approach to your health.
The difficulty of getting an accurate measurement. Somebody comes into your office, they're immediately on edge. Not you, but you're wearing a white coat, and they call it white coat hypertension, right? So what do you do in the office? What should somebody do at home to make sure these numbers are accurate?
I think it's a really important point I want to get across to your viewers, and I talk to my patients every day about. There's 2 groups of patients. Group 1, they've never seen a blood pressure cuff before. They don't know how to check their blood pressure. They have no idea what their blood pressure is. That's a group of patients I'm talking about how to check their pressure at home. Group number 2, check their pressure obsessively, 2-3 times a day, right? They come in with a log that's this big. They are equally an issue as the patients that don't check it. So what I coach patients on is how can you accurately check your pressure? It is not accurate in a doctor's office. It's not accurate in a doctor's office. I actually would prefer us not check it in a doctor's office. And the guidelines now, today, 2025, reiterate this. It's at home. So I tell my patients, and this talks to both groups, I only need you to check it once a week. Not twice a day, not never, once a week. It's got to be seated, at rest, not watching the Ryder Cup yesterday, not watching the Ravens game yesterday.
Certainly not the Ravens game.
No stress, not in pain, feet are flat, you're at rest, your arm is at heart level and relaxed, and you do it 3 times over 5 minutes. And you write those 3 numbers down. And what do we care about? The top number, right? So if you get 150, 140, 130, you're writing the lowest number down. And then you're going to get me a running average over 3 months, because I don't care what one number is. It fluctuates. Blood pressure changes by second to second. What I want to know is over 12 weeks, what is your average blood pressure? And from that, we can make an assessment.
You're going to be very popular. We're going to throw out the high numbers, concentrate on the low numbers.
Low numbers.
What's in the toolkit if somebody has done everything you ask? And they're doing some exercise, maybe it's walking, they're limiting their salt, the number's still too high.
Yeah,
You've got a huge array of blood pressure pills, right?
And again, our 2025 guidelines address this. So if we've done our holistic interventions, we're making every effort we can. Sometimes we can't change our genes or our age, and as we get older, our arteries get stiffer, less elastic, blood pressure goes up, and it's no longer considered normal. So we have lots of classes of medications that we can help our patients to get things that are tolerable, cheap, typically once a day, that can really make a difference. And that's finding the right cocktail and what you can be on, and having a good relationship with your physician short-term and long-term to do that.
These tend to have a lot of side effects. I mean, I'm wondering if somebody, when you give them the menu of options, and one option is go to the gym and the other is pop a pill, some people are going to choose the pill.
Yeah, I mean, again, pills work only so far, right? So we have to make foundational lifestyle changes to really make the pills work the best. And yes, every pill has a potential of side effects, but the good news in 2025 is we have about 100 years of data and science and over 100 different antihypertensive blood pressure medications that we can choose from. So the goal is looking at who the patient is, Jeff, who's in front of me, what are your goals, what are your values, and what can we put and give to you to make a difference for you?
How much is this in the purview of cardiology versus primary care?
Yeah, that's a good question. I think it's both of us, right? So a lot of my day-to-day, a lot of my patient care is helping the primary care doc, right? Because again, our primary care docs are stressed, they're overburdened, they're overworked, there's not enough of them, there are not enough cardiologists. So I think working hand in hand with my primaries has been unbelievably valuable for our patients. So it's a team effort. It doesn't just take one of us, it takes many of us with multiple different contacts to really make a difference.
I read that if you can lower the systolic by 10 points, I may have this backwards, 20% drop in your cardiac event risk?
You're gonna have to ask GPT that one. But yeah, I think for every 5 to 10 points that you can go down, you have a substantial decrease in your long-term cardiovascular risk.
What's the frontline medication? I mean, is there one that everybody's go-to pill, and has that changed over time?
Yeah, it's again, 2025 guidelines aren't very different than 2017, and it depends on who the person is. So there's not a one-size-fits-all, right? So for most of my patients that come in with high blood pressure that have tried the lifestyle changes, the thing that the 2025 guidelines are asking us to do is a combination pill, and I really do like doing that. That's one pill that has 2 different drugs. One's a mild diuretic, makes you urinate a little bit more, and one's a vasodilator that makes your arteries less elastic. That combination of pills works really well for patients with very little side effect.
Here's a question from a viewer. What are the main issues with chronically low blood pressure?
I love that.
Does that happen absent some other issue?
Yeah, actually, I love that question more for the 2 groups of patients that we're talking about, the people that check their blood pressure too much and those that don't check it enough. High blood pressure in the short term is not going to harm you. So that's what I'm coaching my patients that are obsessively checking their blood pressure. You have a blood pressure 140 to 160. Right now, that's not going to hurt you. Yes, in the next 10, 20 years, we need to fix it over the next year, figure out what works for you. But if I overshoot, if I give you too much medication and I lower your blood pressure, I can hurt you today. I can make you dizzy, lightheaded, you can pass out, lose consciousness, break something. So low blood pressure is a problem, especially when we over-medicate. So we have to be very careful about how we choose the medication and how we monitor it.
Susan has a question about the different brands, different types of testers. I find it difficult figuring out which one to use, how to use it, get stressed trying to figure it out. Do you have any recommendations?
Yeah, so I have no relationship with any of the blood pressure cuff makers. I typically recommend Omron, OMRON. There is a website, I think it's bloodpressurecuff.com, but we can, if you guys have a website, I can give you the exact one where you can make sure the cuff you choose is one that is on that list and is verified by our American Heart Association. But Omron is very good. You like the automatic ones, you don't want to be blowing something up yourself. And those are typically range between $40 and $50. They last for a very long time and are very accurate.
Question from Cam, who takes blood pressure at home once a week, lowest of 3, average of 12 weeks. When? Upon waking up, before or after a meal, is there a time of day?
Yeah, another great question. So the reason we do it 12 times over 3 months is I want you to do it random times. The big thing is I just don't want you stressed, right? You don't want to be watching the Ravens game. You don't want to be in pain. You don't want to be hungry or just exercise. So try to do it at different times during the day so we really can get an average of what you've been running over the last 3 months.
You're wearing a fancy watch that looks like somebody who would do a half marathon or something. Can that do blood pressure? I know it can do a pulse, right?
Yeah, so there are peripheral devices now that claim that they can get blood pressure without actually giving pressure on the arm or occluding an artery. I do not recommend using those yet. Those are not ready for prime time. The data for how accurate they are is not out there. This is an Apple iWatch. They don't have blood pressure yet. But again, there are devices, and I don't recommend them at this point.
All right, bottom line for people watching, we've established if it's an emergency level, you got an emergency. Otherwise, you want people to focus on what?
Again, if there's anything you get from this, it's foundational lifestyle changes. Stay a healthy weight, exercise every day, try to eat well, control your stress, sleep well, and we miss social fitness, right? Having hobbies and having fun, keeping stress low. It's those things are more important than any pill I can give you.
Dr. Jeremy Pollock of the University of Maryland, St. Joseph Medical Center. Doctor, thanks for stopping by.
Thanks for having me on.